So yes, so the phase I suppose that I'm talking about was about enhancing palliative care provision by primary care occupational therapists and physiotherapists in primary care. So I'll just switch that on. Sorry. I don't know why it's not switching. There we go. Okay, so the aim of this project was to improve the access to palliative care for those in the community by providing accessible and up-to-date training for the OTs and physios who are delivering primary care throughout Ireland. So in this case, the ECHO Hub was the OTs and physios. So it was kind of the specialist healthcare professionals in Milford Care Centre and Our Lady's Hospice and Care Services in Harold's Cross. So we had OTs, physios, a dietitian, a nurse manager, and it was led by the Palliative Care National Clinical Therapy Leads. And the spokes were the OTs and physios who were working in primary care and took part, remotely from their workplace. It was I suppose funded by the HSE in partnership with the clinical care programme, like all of these. So because the aim was to improve the kind of palliative care provision by OTs and physios, the curriculum was informed by the domains of competence from that palliative care framework set out by the HSE from 2014. So that's those 6 principles there on the left side of the screen. And the ECHO team came up with 14 topics that they thought were relevant to OTs and physios, and they were presented to the spoke participants, who then selected these 10 as being the most relevant prior to the commencement of the programme. So the actual ECHO clinics themselves, they took place between April and October last year, so it was over a 4-month period, and there, let me just move on. Yes, so there was 10 video conferences in that 4-month period. Again, they happened through Zoom, and they took the typical format of the didactic presentation from the specialist clinicians and academics, and then the anonymised case study discussion. Where I came into it was for this evaluation part. So we want to look at the impact of delivering education using ECHO on their self-reported confidence in their knowledge and skills in addressing the palliative care needs of their primary care clients. So much like kind of how Alice described there, our evaluation involved, I suppose, pre-ECHO survey and focus groups, ongoing session evaluation, which was again kind of questionnaires collected by SurveyMonkey, again with kind of lesser, I suppose, feedback, and then the post-ECHO survey and focus groups. Again, we did 3 focus groups with the spoke members and 1 separately with the hub members. So if we just kind of fly through the results, the spoke participants, there was 26 of them, 16 OTs and 10 physios, and if you look there at the map on the right hand side, they were distributed around Ireland, kind of from Donegal to Cork and some places in between. And we had 1 OT dropout actually mid-programme, just due to work pressures. But it's worth taking a look at kind of the years of experience. So something like 81% of the therapists who took part had over 10 years of clinical experience, and 54% of the therapists had over 10 years of experience in primary care. So I just want to emphasise that they were quite an experienced bunch. In terms of palliative care though, while 65% of them, 17 had said they had experience of working with clients with palliative care needs, most of them had gained that experience through primary care, 2 had acute hospital experience, and the overwhelming majority, 96%, felt that they would benefit from additional training for palliative care for OTs and physios. In terms of further education, only 19% of them had attended any seminars or conferences in relation to palliative care, and most actually relied on kind of discussion with colleagues and peer education. So there was a learning need there. The focus group that we held with them beforehand, they reported that anywhere between 5 and 20% of their caseload in primary care had palliative care needs, and this was mainly for people at end stage of life. They were dealing with people with terminal cancer and then progressive neurological conditions like MND, MS, Parkinson's and end stage dementia. While some of the occupational therapists had reported that they did get involved in kind of symptom management, anxiety management, and energy conservation, most were mainly kind of using these compensatory approaches like equipment provision, pressure care and positioning, and care education. And the physios were usually involved for mobility, strengthening, and manual handling. Participants felt that they, I suppose, often tended to refer clients onwards, and they felt they had limited capacity for follow-up, and it was a source of frustration for them. They often felt as well they were meeting clients at quite a late stage of their kind of palliative care journey. They reported that they weren't very familiar with their palliative care colleagues, and they had very limited contact with them, and they wanted to have more confidence in their skills and also in terms of how they communicate with the clients. So that was before the program. Then the 10 sessions occurred, and this is just a table of the attendance. So kind of between 16 and 26 people attended each of the sessions. There was 13 hub members available, but typically 5 would be present for any one clinic. And over the course of the 10 sessions, 17 case studies were presented by the spoke participants. These were the kind of pre and post survey evaluations. So you can see here that despite their many years of experience, the confidence levels of these primary care therapists were extremely low, represented there in the blue bars. So they're low confidence in their skill on the left and in their knowledge on the right. This did significantly improve, and using kind of the statistical analysis, the orange bars represent the huge improvement in their confidence in their skills and their knowledge, again across those 6 domains of the competence framework. So we use that to inform the curriculum development, but also the evaluation as well. In terms of the impact, again, like 95% of the participants felt ECHO met their learning needs, and 85% would recommend it to colleagues. They overwhelmingly valued the format of ECHO. Again, 95% had felt that it was an effective format for improving knowledge, and a little bit less, 75% thought it was effective for improving skills. They reported that they were having access to education that would have been otherwise very difficult to get to due to the geography where they were. So a lot of them worked in very rural areas or that didn't have direct links with, hospice settings or specialist palliative care settings. And obviously there's huge time pressures in primary care, and as we know, long waiting lists. So this format made it a lot more accessible for people to take part. So post-ECHO, we held 3 focus groups with the spoke participants and 1 separate one with the hub participants. And kind of these are the 3 key themes that emerged, and there were some others. So an expanded scope of practice, community of practice, and then just the utility of the ECHO format. So I'll fly through these. In terms of the expanded scope of practice, I've got just kind of a couple of quotes here where I'm just trying to illustrate how participants felt that, they had a better understanding of their scope of practice, they were more confident in the assessment and treatment approaches, and they had a better awareness of community resources. So prior to joining the ECHO program, many participants had said they tended to kind of adopt a more of a hands-off approach with palliative care, clients with palliative care needs, but after having a more I suppose, opportunity to engage in training and understand kind of comprehensive assessment and treatment, they're more comfortable with this. So this person said, I feel I can go a little bit further, I can ask more questions and give more advice, deliver more, I wouldn't say specialist intervention, but further intervention. Before I started the ECHO program, I would have been, I'm not really sure, I don't really know much about this. Again, the more comprehensive approach to assessment was, I suppose, really important. And this person says, I'm asking more questions and getting more information. I feel more confident to deliver more advice and signpost more services. I feel I can offer more now following that course. And this OT said, from an OT perspective, our input for palliative care was mostly equipment provision. There's so much more you can offer: fatigue management, pain management. And this person said, it did lead me to setting goals that might have been missed otherwise, and I wasn't afraid of it. Before, it might have been something I might have avoided because I was feeling uncomfortable in myself. And I suppose this kind of enhanced knowledge of best practice, evidence-based interventions, practical techniques, even like the use of fans, you know, for breathlessness. For a lot of people, this kind of boosted their confidence and affirmed their role. And people, I suppose, once they learned more about certain topics, they kind of recognized the opportunity to provide interventions beyond typically what they would have done. The other thing to talk about was the community of practice. So participation in ECHO obviously allowed establishment of this network of healthcare professionals who are working in palliative care, which is really valued by the participants. They reported it was really useful to hear about practice kind of across the country. So hearing from people in different counties that were experiencing kind of similar difficulties, similar challenges, or adopting similar approaches in their effort kind of to provide quality services, they thought that allowed a lot of sharing of ideas. So this person says, you know, we're all in somewhat similar boats, wanting to provide the best possible service to this client group, and we're all doing what we can, and there was great ideas generated through the format. So they really did benefit from that kind of sharing. Also through participation in ECHO, participants forged links with local with the local community palliative care teams, and that also led to better continuity of care for the clients they were working with. People talked about having more confidence in kind of negotiating and liaising a plan of action when they got a referral. So if I got a palliative care referral, I would be more inclined to liaise with the lead person to say, what is the plan here? What are we doing? And how are we liaising with palliative care? And participants also had intentions to kind of exploit these relationships that they'd fostered even further. So, you know, this one person saying we're going to do a meet and greet with them tomorrow, talking about the palliative care team as a result of Project ECHO. So we're all going to have a better understanding of each other's services. While it has always been good, it's only going to get better because of Project ECHO. So people thought that those relationships had improved, and it had kind of opened up lines of communication. Lastly, the utility of the ECHO format. So overall, participants reported a really positive experience of ECHO, and they thought that it was preferable that the programme ran over a number of months rather than, say, a 1 or 2 day intensive course. This person saying, you had the presentations, you had all the online information, I dipped in and out of it and I read about it, I think a bit more and think about the clients I'd worked with. It prompted reflection and practice, and also to get the really up-to-date information going forward was hugely beneficial. Again, like I've already talked about, people in primary care felt that they were all a bit time poor, but with ECHO they could get the knowledge fairly quickly, precisely and succinctly. It was very cost effective with regard to time, patient time that we would have lost out on. So again, really appreciating that online format, which obviously we've all since embraced. The use of case studies was more of a contentious issue, and obviously it's a key component of ECHO. Some participants did benefit from engaging in the case study presentations, and others found it to be more of an ineffective learning method. They were more reluctant to engage in it, and the hub members also noticed this reluctance to engage in case studies. So just a quote here about that: the case studies, while I thought were interesting, I don't know that I did gain a lot from them either. I would probably like a little bit more discussion, maybe prior to the session. Could reflect on the topic and then see have we questions around it in relation to specific clients. So some people had wanted to kind of have more integration of the case study throughout the session rather than a presentation at the end. And I guess the hub members had felt that maybe if there was more initial meeting at the start where all participants would have come together, that could have built a bit more of that cohesion and trust, because they felt that was one of the key things. So creating that group bond, as this quote here is talking about, and they've allowed the spoke members to participate more and maybe to be more confident in kind of sharing the gaps in their knowledge. And some of the hub members also felt maybe that having a more consistent kind of central hub membership might have had led to better engagement. So, you know, having kind of an expert panel or 3 key members. So just in conclusion, improving access to palliative care is obviously a high priority for people with life-limiting conditions. And while the primary care OTs and physios frequently encounter people with palliative care needs, they really had reported they weren't confident in their role, which does indicate the need for accessible training such as something like ECHO. Many of them had described a desire to liaise more with specialist palliative care teams, and so there was a need for this stronger kind of like network or community of practice among specialist services and community colleagues. And I suppose ECHO has shown that we've achieved that, and it's been effective in improving their confidence in both their skill and their knowledge. Timely and appropriate palliative care for people with serious illness is obviously very important. That they're not just receiving input at the end of life, and hopefully maybe with these spoke participants having more confidence, more awareness of concepts like palliative rehabilitation and comprehensive assessment, they may advocate their role, they may seek earlier referral, and I suppose offer more to the clients they meet. But I guess in saying that as well, a lot of this does depend on improved primary care access as well. And that's one of the things that while ECHO might have that force multiplier effect, a lot of it is actually kind of dependent on how, I suppose, primary care is under-resourced or understaffed, if people can even attend training like this. So I suppose it will be most effective in the context of improved primary care. Just our own dissemination from this phase of ECHO, we have submitted a manuscript for publication in Health and Social Care in the Community and conference abstracts to the OT and Physio national conferences, which are happening online. And hopefully next year we can look to sharing some of the other stuff at palliative care conferences. And just, thanks to the team who really made the whole thing work.